We are Utah. These are our communities. Utahns don't sit back. They have a commitment to volunteerism. They lean forward and get involved and have been recognized for service to others. From Logan to St. George, Tooele to Moab, our statewide culture of service defines who we are.
I love Salt Lake and I love Utah. It's the most awesome community that I can even imagine. This community, it really does step forward. We're #1 in the nation in volunteerism in Utah. It's something that's part of our culture, to serve one another and to help one another and to support each other. And that's what I love best about living in Utah, is the people and the way everybody gets together and tries to help each other as a community.
It is amazing to me to see the community come together when they're aware of a need. It is overwhelming to see. People want to help and they want to know what they can do, and they love to see the families receiving the services. Is awesome.
Community stewardship, volunteerism, and nonprofits strengthen the idea that acts of good can produce monumental change in the home, communities, and the state. Nonprofit and community organizations throughout Utah help thousands of individuals and families annually.
You know, as a not-for-profit health plan and a not-for-profit health system, we realize that we cannot meet all of the needs of an individual in a community. A lot of the not-for-profit organizations that we're privileged to work with in Utah are really a safety net. They're a safety net for people who have no other resources. And like Select Health, these safety net providers, they're looking out for the well-being of the community at large. Many people are struggling. They're struggling with access to safe environments, access to school, access to good food, job training. There's many aspects of a person's lives that affect their ability to be healthy and productive. But we really want to work together with people that have expertise in these areas and can really help promote safety and other services, whether it be language services, after-school programs, access to legal services. There's just so much that people need to have a full and productive life. So all of these community service organizations and the healthcare system can work together to help make sure that people have the well-being and security that they need to be fully productive in their lives and in their families.
They protect, feed, heal, shelter, educate, and nurture our bodies and spirits. They also give shape to our boldest dreams, highest ideals, and noblest causes, turning our beliefs into action. Promoters of healthcare access, offering caregiver resources, responders in times of trouble, stimulators of the economy, and weavers of community fabric. These organizations partner with public and private sectors to fill service gaps and solve our community's most challenging problems.
Our community thrives when we are whole, when everyone has what they need to survive. Serving a few folks with dignity, kindness, and great resources benefits the entire community by making us a whole family and making everyone the same.
Many individuals and organizations are working to ensure the health and well-being of those around us. People are never as grateful for their health as when it is gone. Good health provides tremendous benefits. We have made incredible advances in medicine, but far too many people don't have access to basic health care.
Innovation comes from the core mission of an organization, and our mission is to help people live the healthiest lives possible. If we're going to fully realize our potential, we've always gone and trying to find new and better ways of doing things.
Many organizations educate our communities on nutrition and exercise, stressing the importance of a healthy life.
Poor health has a cascading effect in our community. It starts out with the individual, but then it affects their family, which affects then their ability to show up for work, to get their children to school, to provide a healthy work environment with those that they work with in their communities. as well as the industry that we so depend on them to run.
When you keep individuals healthy, you keep the community healthy. A disease anywhere is a problem everywhere. So we feel lack of access to health care can be a threat to the community. So by helping the refugees maintain health promotion, health wellness, good dental care, have access to vision care, that we are not only making them healthy, but we're making the community healthy.
There are also others that live with poor mental and emotional health conditions. Oftentimes, these individuals are defined by what they can't do. Community-based organizations are stepping forward, helping us all reach a state of physical and mental well-being.
Some of the problems with mental illness is our stigma with mental illness. It's a big barrier to those that are seeking treatment. What's really people need to realize is it is more common to encounter someone in a mental health crisis than it is somebody with any other crisis, such as a heart attack or other medical illness. 1 in 4 people will experience a mental illness every year. So 1 out of 4, 25% of our population. Yet we see big stigma and hesitation to seek services. One of our goals is to eliminate that stigma. We do have research showing that those that seek treatment are very successful. Up to 80 and 90% of those that are seeking treatment for depression have positive outcomes.
For some, special populations represent an underserved demographic. When most people think about inclusion, they think about children and adults with disabilities being included into typical mainstream programs. But inclusion should extend beyond that experience and into the community.
When a family is strong, a community is strong. And so we really benefit the community by empowering families, by strengthening them. You know, you look at families that have kids with special needs, and the divorce rate is actually pretty high. But when they receive services, research has shown that the divorce rate almost normalizes to national standards, or if not a little lower. And so by providing such services as respite or autism services or early Head Start or early intervention, we're able to help families stay together.
While difficult to quantify, the benefits of working with individuals with special needs can have a long-lasting and far-reaching impact on people and communities. Social skills are improved, empathy is enhanced, and gratitude is magnified. When people look past themselves, they begin to see hope and possibility.
When you get down on the floor with a child with special needs, your heart instantly changes. I truly believe that. You see the child in their eyes, and you see who they really are. And when the community takes the time to get to know somebody with special needs, it softens us, I think. It allows us to see that we as human beings are unique and we have different abilities, whether we have special needs or not.
I mean, I think most people are pretty sold on the idea that children are special and we want to help them succeed. And kids that have a little extra challenge, they need a little extra help, but they're the same as all other kids inside, and they just want to play, they want to jump and swing and slide and reach their dreams. And so that's, at least I'm glad that in this community, people really believe that.
Safe environments are more than just spaces where individuals feel protected. They are places and programs where men, women, and children can move along a continuum from awareness of problems to life-changing solutions.
One of the things that we really like at New Horizons is being able to work with the children that come in. They are often the most traumatized people that we deal with. They don't have a choice in the violence that is happening in their life. They don't have a choice whether they're staying or going, or the fear that comes from that. The fact that they can be afraid daily and not know what's going to happen. They can go home from school every day and not know whether their house is going to be happy or sad. And at least while they're here, they can come to a happy place and be able to get a start and take a step to be able to deal with the stuff that they've been through.
I think that when we have this idea that we're all in this together, that there's no one organization that can fix everything, we all have to be a part of the solution, that we really can make a positive impact on the community.
At Boys and Girls Clubs of Greater Salt Lake, our clubhouse doors are open to every child from every walk of life, but we strategically put our clubs in locations that the kids who need us most have access to our clubs. So sometimes the kids can't control what their environment is. They don't have a say in what their income is in their household, or if mom and dad are working, or what the violence and crime rate of their neighborhood is. But they have control when they walk in our doors, and they can make better choices here. And sometimes we as a community just have to step up, and it takes a village, and we have to, help the kids, because it takes all of us, from nonprofit organizations like our club, to the schools, to community partners like Select Health. And when we all come together, we can bridge that gap and make a better future for our kids and our community.
Strong communities incorporate a basic principle that people should be able to get help where they are, when they need it, with ease and without stigma. Providing a layer of protection for children, a nurturing environment for families, and a social link for people of diverse backgrounds.
Diversity makes a community better because different points of view, different people, different languages, different food, different opinions, they all create a really beautiful tapestry of different ideas that if we just rely on ourselves, if we were to eat the same thing every day, if everybody was the exact same, we wouldn't know what else is out there. And it's really important to look outside of ourselves to see that there's a lot of beauty in things that are different and diverse.
Every time I think that somebody can overcome a hardship and feel relief. That's one of the big things people in the group mention, is that they feel relief, and that they also want to move past surviving and coping, and that they want to thrive. And it's really wonderful. We just had another group wrap up, and people were giving each other compliments on how they can see that their lives have changed, and that they don't need to rejoin the group for the next session, because they feel that lightness and that freedom, and they're moving on with their lives with hope and love and new things. And that's really, really beautiful, that they can also then go out and refer other people, which happens a lot. Like, hey, this changed my life. I'm doing a lot better.
Health starts in our homes, schools, workplaces, neighborhoods, and communities. We know that taking care of ourselves by eating well and staying active, not smoking, getting the recommended immunizations and screening tests, and seeing a doctor when we are sick all influence our health.
So when you think about it, health is a team sport. So when we take healthcare organizations, along with community institutions, whether they're churches or whether they're volunteer organizations or whether they're businesses, if we pull together and share accountability and share goals and then drive forward in unity, just about anything is possible. Even great organizations like Intermountain, including Select Health, we're big and we're strong. We can't do almost anything by ourselves. So if we're going to affect the social determinants of health as well as the objective healthcare delivery, we can only really do that effectively if we play as a whole team.
Our health is also determined in part by social and economic opportunities. The resources and support available in our homes, neighborhoods, and communities. The quality of our schooling. The safety of our workplaces. The cleanliness of our water, food, and air. And the nature of our social interactions and relationships. The conditions in which we live explain in part why some people are healthier than others.
Health and health care are two different elements. Health care often occurs in a doctor's office or a clinic or a hospital, but health occurs where we live and work and play. And health affects all of our communities, all of our neighborhoods, and we know from the research that health care affects only about 10% of a person's overall health. And there are so many other factors about behavior, about access to good food, the ability to exercise, the ability to get outside, the ability to be connected socially with other people in your community, be connected with houses of worship. So many of these other non-clinical factors are important. They're often called social determinants of health. Where you live, where you work, your access to food, your access to other support services, those all impact your overall health and well-being. And those are things that the healthcare system cannot provide. So we feel it is just extremely important to partner with others in our community who have expertise and services and resources in all of these areas. It does come back to this concept of collective impact, or a common vision for what we can be and how we can, in fact, be the healthiest state in the country. This ties so closely to the Intermountain and Select Health vision and mission of helping people live the healthiest lives possible.
To you, the recipients, we honor you this day and celebrate the selfless work you are performing. We encourage others to follow your example, to lift and strengthen. Together, the small acts of goodness and kindness will affect positive change within individuals, families, and the communities in which we live.